Sports physical therapy really focuses on the needs of the athlete. These are people who are really trying to get the most out of their bodies, and they need them in the best shape. So not only looking at rehabbing from injury and sports injuries, but also previous injuries and things that might be lingering from those problems. Sports physical therapy isn't an isolated approach to physical therapy. It requires a deep understanding of manual therapy to be able to both assess and treat joints through a manual therapy approach, and then have an orthopedic background to understand how muscles and joints work, both for tissue repair and post-surgical rehab, but then progressing to a higher level of performance that's required for the athlete. So when an athlete comes in, we're looking at if they have an acute injury or they're just interested in performing at a higher level. So we'll go through a history if they've had any previous injuries that might prevent them performing at a peak level. And then we'll go through and do a full assessment of joint motion, range of motion, movement analysis, and look at tests more related to returning to their sport. The goal for us is not only to get you to return to play, but return to play well. So one of the key differentiators for our version of sports physical therapy is we're actually starting with the tissue itself. What is the tissue injury and what does it need to get back to? On top of that, what is the function of the joints around that tissue? So a joint is moving too little or too much, so we have to go in and assess the mechanics of that joint. And then on top of that, it's looking at the motor control. Any injury or pain will change the way the body recruits muscle, so you'll have a different movement pattern or compensation. So to have a movement eye to get in there and really assess the change in movement, the compensations in movement, and how can we normalize that to then return you to exercise in general and then get back to sport. Sports physical therapy can help you look at where your body is today and ensure that you can continue to play hard and play fast in the future. We're always looking 10 years out. How can I train my body today so I can continue to perform at this level in 10 years?